Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, How to treat trichomoniasis at home. Risks and effective treatments. Trichomoniasis is a prevalent and curable sexually transmitted infection, STI, caused by a protozoan parasite, Trichomonas vaginalis. It is more common in women than men. In 2018, 2 million infections were reported. However, only about 30% of people develop symptoms. /r/n/r/n If you experience trichomoniasis, it can be tempting to treat the condition with natural or alternative remedies. However, the most effective treatment is medication from a healthcare provider. /r/n/r/n/Satjawat Boontanataweepol Getty Imagesrnrn Many home remedies thought to help treat trichomoniasis have not been thoroughly researched. The best treatment option is antibiotics. Sometimes, though, people become antibiotic resistant and more research is needed to help determine other treatments for this infection. /r/n/r/n Some studies suggest that topical vaginal treatment can be an alternative to conventional treatment in people who have allergies or are drug resistant. /r/n/r/n More research on home remedies for trichomoniasis is needed. While some home treatments may be effective at killing trichomoniasis naturally, many studies were done in vitro, in a laboratory setting and outside a living organism, like in a test tube, or with a small sample size. /r/n/r/n There are several home remedies for trichomoniasis. Examples include, /r/n/r/n Myrrh One study examined 33 women with trichomoniasis. Researchers treated 13 antibiotic-resistant women with an oleo-resin extract derived from myrrh, Commiphora molmol, Myrrh. /r/n/r/n Participants received 2 capsules, 600 mg, for 6 to 8 days on an empty stomach 2 hours before breakfast. The treatment was effective in 85% of the test participants. /r/n/r/n Phyto-chemical-rich foods, black tea, green tea, grapeseed extract, and pomegranate may be effective therapies, particularly black tea. In a 2017 study, black tea was effective against the strain of trichomoniasis that affects humans. Other strains affect various animals. Additionally, the black tea preparation was effective against drug-resistant trichomoniasis. /r/n/r/n Garlic and others in the allium family, for example, onions, have demonstrated antimicrobial, antiviral, antifungal, and antiparasitic properties. However, many studies on garlic and other allium plants are in vitro. More research is needed to determine if garlic and other allium plants are an effective treatment. /r/n/r/n Milk Thistle Silybum marianum, more commonly known as milk thistle, contains an antioxidant compound called silymarin, which may be effective against trichomoniasis. /r/n/r/n Ginger. A 2016 study used mice cells to determine that ginger ethanol extract was an effective treatment against human trichomoniasis strains. /r/n/r/n Other herbs and plant-based treatments. Several additional plant-based compounds may be effective, such as black cumin extract, papayas, ginseng, berberine, curcumin, and more. /r/n/r/n Researchers have found positive results when testing creams made with herbs and compounds in plants known to have antibacterial, antifungal, antioxidant, and antimicrobial properties. /r/n/r/n However, most research has been done in vitro and not directly on humans. Additionally, of those conducted in humans, many had small sample sizes. /r/n/r/n It's also important to note that supplements are not regulated by the Food and Drug Administration, FDA. So, the quality and purity of the products vary among brands. Dosages in humans are also not yet established for many alternative treatments. While some alternative therapies may be effective, additional research is needed. /r/n/r/n You may have heard that treatments such as hydrogen peroxide or povidone-iodine douches can treat trichomoniasis. However, these treatments are often ineffective and can even be harmful. /r/n/r/n Before attempting any home remedies, especially topical remedies or douches, consult a healthcare provider for advice. /r/n/r/n During treatment, you can also include foods that are naturally rich in antibacterial, anti-fungal, and anti-microbial compounds. Eating a diet rich in fruits, vegetables, and other plants may improve overall health and longevity. /r/n/r/n While extracts and concentrated supplements of certain plant compounds may work against trichomoniasis, consuming whole food is unlikely to treat the condition. However, consuming foods used to treat trichomoniasis, such as pomegranates, garlic, basil, and foods with resveratrol, may provide overall health benefits. /r/n/r/n Be sure to consult a dietitian or healthcare provider before making significant dietary changes. /r/n/r/n Researchers know that people need more options for treatment, especially because they may become reinfected or be unable to take traditional medicines due to side effects or allergies. More research is necessary to explore alternative remedies to treat and prevent trichomoniasis. /r/n/r/n Oral Flagyl, metronidazole, is a recommended treatment regimen for trichomoniasis. An alternative medication for men and women is Tindamax, tinidazole, which is more expensive but has fewer gastrointestinal side effects. /r/n/r/n Sometimes, treatment doesn't work. Treatment failure may be due to not finishing all of the prescribed medication or reinfection by a partner who also has trichomoniasis. A higher dose or combination regimen with 2 or more medications may be necessary. /r/n/r/n If there is a possibility that your partner also has trichomoniasis, they should be tested and treated, too. Abstain from sex until treatment is completed and symptoms have resolved. /r/n/r/n Ideally, females should be retested, if possible, in 3 months after treatment to ensure the infection is gone. There are insufficient data regarding retesting males. /r/n/r/n Special considerations must be taken if a person is pregnant, has human immunodeficiency virus, HIV, or is allergic to metronidazole and tinidazole. /r/n/r/n It is unlikely that trichomoniasis will go away on its own. However, some individuals with trichomoniasis can be asymptomatic for a while. If left untreated, serious side effects can occur, especially in pregnant individuals. Side effects can include /r/n/r/n Other risk factors of untreated trichomoniasis include /r/n/r/n Trichomoniasis is a common and treatable STI. If you suspect trichomoniasis, contact your healthcare provider for testing and treatment before treating the infection at home. You may have additional STIs or a different STI with similar symptoms. /r/n/r/n If you test positive, you will likely receive a prescription for oral antibiotics, such as metronidazole. Discuss your treatment plans with your healthcare provider if you are considering a home remedy or already tried one. /r/n/r/n There are few studies examining alternative treatments for trichomoniasis in humans. Your healthcare provider will likely want to repeat testing as home remedies may not effectively clear the STI. Untreated trichomoniasis can pose health risks. /r/n/r/n/r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.